Hey guys, so today, oh, sorry, I'm Stacey, for those of you that don't know me yet. We gave a talk about running mechanics a few weeks back, and then I'm back again. We're talking about knee and hip health. So more specifically, we're probably just gonna go over some exercises that might not come too obviously to you and why we're doing it. So why are we training to run? So I think most people think that like we're running, so it's kind of like a really easy thing. You can do it anywhere. You don't need any equipment, and you think that the running itself is going to be your exercise. But at the end of the day, running is like any other sport. You're actually going to be doing something that has like a repeated set of movement patterns. So then that's the same case if you play basketball, if you play soccer. So like all of these things have repeated movement patterns. So when we run, we're going to do the same thing over and over again. And what that's going to lead to, if we don't do something about it, is overuse of certain muscle groups or just a muscle imbalance just by the way that we fire those muscles. So when it comes to our hips and knees, I'm not going to be talking about power per se, or like trying to gain a lot of strength, trying to like power through your run. What we're more going to talk about today is actually stability in order to maintain your joint health. So specifically, we have two types of stability in our joints, and this is true for all joints where we're talking about hips and knees. We have a force closure, which is provided by your muscles acting on the joints, and then we have a form closure, which is provided by the joint itself. So these things are important because you do need both to actually have a nice balanced joint that's going to suspend itself in space and then not wear and tear as much. So really what we're looking at is when we don't have a good balance of your muscles providing you that force closure, what's going to happen is we rely a lot more on that form closure, which means that the space in your joints are going to become a lot less just to provide you with the stability it thinks it needs to actually perform the task that you're going to ask it to do. So that's why it's super important to have both, because if you don't have the muscular strength to maintain the space, then when you start closing in that joint, you're going to start rubbing it and you're going to start wearing and tearing it over time. So we're going to look a little bit at the anatomy and then what we're kind of aiming for here. So here we have a hip joint. So you guys can see it's a ball and socket joint. So you have your acetabulum, which is the socket that it's in, and then the head of the femur, which is that ball, and they fit together, but you should have a little bit of space. So you guys can see there's like a little bit of space in there, and it should kind of float freely. We do have this portion on the inner layer here that is actually your labrum, so that makes it a little bit deeper, so it makes it a little bit more secure. So when we talk about a form closure, then this is the form, the shape of your hip that actually provides you some stability. So the fact that you have a labrum to make it a little bit deeper, then that's going to provide you a little bit more stability. So in an ideal hip, what we want to see is you want to see like your muscles working to do the tasks that they're supposed to do. But what you can't see is that there should be a little bit of a push and pull with your muscles. So say if we're looking at the first image we're going to look at is external rotation and internal rotation of your hip. So what you'll see is the green muscle is the one that's turning on, and then the red muscle is the one that turns off. So you see when you go into external rotation, your piriformis, your glute med, all that kind of stuff is going to turn your hip outward. But as it's turning outward, you can see that your IT band should turn off. The hamstrings should turn off. So anything that's actually going to internally rotate you, because you see it turns green when it internally rotates. So anything that should do the opposite movement should let go when the primary mover is acting. And that's where we kind of go astray when we talk about like muscle imbalances. More often than not, you get a push, you lose that push and pull. So where normally you get a relaxation of a muscle, it might stay on or it might be short. So one thing to keep in mind is there's a bunch of reasons for that. You might have a short muscle because it's weak. You might have a short muscle because it's overused, or you might actually have a long muscle because it's weak, or that it wouldn't actually be long normally if it's overused, but it can be tight for a couple different reasons. And the same thing is going to happen with your hip. So you see when you flex your hip, the things you normally think of as your hip flexors, your psoas, your iliacus, that's all going to pull your hip forward. And then you'll see your glute turns off as it goes forward, and then it kicks back on as you do hip extension. So that's kind of important to know, because when we're trying to kick and like do your stride and trying to get a little bit of power from your glutes, you should actually have the ability to turn off the muscles in the front of your legs to get a nice little balance of your muscles. Because if you don't have a good balance of the pull of your muscles, you're going to start getting a little bit of pull either upwards or a little bit anterior for most joints. But then when it's a little bit derailed, what's going to end up happening is if it doesn't fit in the socket quite right, we're going to end up with a situation like an osteoarthritic hip. So then that's when you're going to start to lose space in that joint. The cartilage is going to start to wear down because of the friction that you're actually getting in the joint, or that you're butting against things. You're going to develop bone spurs around or on the joint. And then that's when things start to become painful. And the same thing is true for your kneecap. So when it comes to your kneecap, it's the same thing, except there's a couple more joints. So you're looking at like your femur, your patella, your meniscus. So all of those points. So like the inside joint, and then the outside joint, and then the actual patella itself is also a joint. So there's a little bit more complexity about the things that you're actually going to scrape, but mainly what we think about is the space underneath the patella, the space in between the meniscus and the femur on the inside and the outside. So then that's what they usually categorize. But the same thing, you're going to lose space in there if you don't have a good coordination between your muscles to be able to bend and straighten your knee. So with knee flexion, same deal, right? So if you're going to try to bend your hamstring or bend your knee, your hamstring comes on, but you can see your quads come off, right? So hamstrings come on, quads come off, and then when the quads come on, the hamstrings go off. So you want that little bit of push and pull to be a good coordination, because otherwise if they're both on, you're gonna have a little bit of compression. And I wanna say more often than not, most people have pretty overactive quads and then an underactive hamstring. And then if it gets really tight, then that's when you can't optimize how much you use your quads. And then same thing, over time, if you keep doing that same pattern where you're not able to fire your hamstrings and quads in the right sequence, or that you don't have enough strength balance between the two, that's gonna throw off the balance of how your knee moves and shears over itself. So you might get a little bit more compression, most often on the medial joint, but like it can go on the lateral as well. So then it'll just over time degrade down, and the same things are gonna happen. You're gonna lose cartilage, you're gonna lose space, and then you're gonna start to develop bone spurs in the joint. So when we talk about like a good alignment, and you probably get told this all the time, is like we want a good alignment when running. So you don't want to be in a valgus or a bow-legged situation, or in a varus or a knock-knee situation. So a normal alignment, you're going to have a little bit of an angulation because of the width of your hips, but that's kind of a normal alignment. And I want to say a lot of people who are reasonably athletic don't actually present with a valgus that frequently. It's a little bit more often a varus that you'll see you standing with. But even if you're standing and you go, oh, you know what, that alignment looks really good, like my hips and my knees and my ankles, they all seem like on top of each other. That's a good thing if you have a good starting point of not having any of these positions existing just when you're standing still. But if you look at your legs and go, oh, you know what, that's pretty normal alignment, I don't see why I'm having problems with my hips and my knees. The thing that we want to talk about is actually the dynamic stability that's going on. So you might see this alignment only when you're still. So the thing that I want you guys to try, and if you want to, you can try this along with the video, or you can try it at home later just to see what it looks like. So we're going to talk about like 2 tests that might give you a good idea of what's going on. And I'm going to cut a couple of things, or I'm going to give a little bit of pointers as to like how somebody cheats, and you'll actually see it in the video a little bit too. She cheats a little bit. So one good thing to try to take a look at what your dynamic stability looks like is doing a one-legged sit to stand.
Sit up straight with your buttocks to the edge of the chair. Lift your unaffected foot off the ground and keep it in front of you. Try to do this exercise without using your hands. Keeping your affected knee in line with your toes, stand up by pushing down through your foot until you're completely upright. Hold this position and then gradually sit back down. Control this movement and then repeat. Make sure your knee always points directly in front of you.
So she does a pretty good job at this, but I'm going to point out a couple of things. When she does that sit to stand, and I like to try to get people to avoid this when they're actually doing this in this test, when she goes to do the sit to stand, you'll see that she tries to momentum herself out of that chair initially. So there's an initial little jolt that she tries to put in. So then that's her closing in a little bit, trying to create a little bit of force and trying to go up with momentum. So ideally, I'd like you to be able to do that dynamic stability without actually using any momentum on the way up. So then that's when you truly know that you have a pretty good balance in that hip. And then you'll see for her, she has a little bit of valgus when she actually goes to sit down. So it's reasonably aligned when she's standing and when she's sitting, but you see that little bit of knock knee that she does. So it's that over and over again that we're doing, because if we're running and we're on one leg, you're basically going to have that little bit of shift over and over and over again. And that's really what's going to cause that damage in the knee. Even though you think it looks right from the beginning to the end, if you're only looking at the beginning and you're only looking at the end, it might seem okay, but you might want to look at that transition as you move through range, because that's kind of the more important part. And I think that's where most people lose their attention for keeping dynamic stability. The next one we're going to look at is a step test. So it's kind of the same thing of like looking at your balance, but being able to like step up and over a step.
Stand up straight facing a step with your feet hip width apart. Stand close to the step. Place your affected leg on the center of the step. Step up and over, bringing your unaffected leg from one side of the step to the ground on the other side. Step your affected leg down from the step so that both of your feet are back on the floor.
So she does a much better job at the control. You see that there's really no wobble in her knee. It's pretty slow moving on the way up. She doesn't do any momentum on the way up or drop her foot on the way down. For most of you guys, if you guys are in the second or the third group for running at this point, you're probably going to find that that's a little bit too easy. So you might want to do something a little higher than that step. So she's probably using like a 6-inch or an 8-inch step there. And again, these are things that might indicate to you what your strengths and weaknesses are, but you can also use these as exercises at the end of the day. It's just that this is going to be like a compound way to move instead of the smaller exercises that we're going to give you. And then one thing we talked about before was the stability or the balance between your muscles. So when we're doing exercises, we want to look at not just your quads, because I find that your quads actually get used a lot, and we will fire those very readily most of the time. There are exceptions to that rule, but I find that most of the time people can fire their quads. It's actually weirdly the thing that gets in their way is
stand up.
Actually their hamstrings. Oh. Sorry, I think I have this. Sorry, we're gonna move their glute medius, and then we'll move on to the hamstring. So one of the things that actually causes that little rotation in your hip coming inside and then the valgus is that you don't have a strong glute med. So you've probably heard this a lot. It's like hip stability is basically glute med exercises. You got to be able to do glute med. So we'll show you a little progression of some exercise that you can do. So it just turns out your hips so that you don't have that knock knee position, and it stabilizes your hip and then gives you that space in the hip.
Lie on your side with your feet, ankles and knees together. Bend the legs a little and tighten your core stability muscles. Keeping the feet together, lift the top knee up. Make sure you don't roll your body back with the movement. Control the movement as you bring the knee back down to the starting position.
And then that's the easiest one. And then you can progress yourself to this one.
Lie on your side with your affected leg uppermost. Keep your back straight and trunk still. Slowly lift your top leg upwards. Ensure your legs stay straight. Lower the leg back down.
So we'll start with those, but really we want to actually be doing things in standing. So once you get the hang of that and that you know your glutes are firing and something is happening with your glutes, you can move on to things in standing.
Lie on your
So you can do a glute med activation in standing. This one's really great because it actually does two things. It works out the glute med because you're externally rotating that hip on the left one for her, and then in this image, she's going to do the left one when she turns it out. And then the right one is she's going to stand on it. So actually you get a lot of effort from having to stand on that leg. And that's something we want to be able to do too, be in a single leg stance and not have that hip turned in.
Stand with your healthy side alongside a wall. Balance on your affected leg and raise the other leg, bending at the knee to a 90-degree angle as if marching. Hold your bent knee up and then push it against the wall. Make sure that your other knee does not turn inwards during the movement. Hold briefly and repeat the exercise.
So that's kind of a more isometric version of trying to get that movement. She does do a little bit of active external rotation on that knee that's on the wall, but it's pretty good because it does a little bit dynamic on one leg and then it's isometric on the other leg. And then we'll get far more complex. I think you've seen this before, maybe in Leslie's presentation as well. So then you have a compound movement that's going to look more like your running, your actual running motion.
Stand side onto the wall with a ball between your thigh and the wall. Press the ball against the wall using your thigh and hip muscles and lift your leg off the floor with the knee bent and gently push the ball against the wall with this thigh. Bend the leg you're standing on and move into a slight squat. Maintain this position whilst you move the thigh with the ball backwards by moving through the hip. At the same time as your leg moves backwards, move your shoulder near the wall toward your opposite hip by twisting through the upper back. This exercise is an important movement component of effective running.
So then that's way more dynamic, right? So you're talking about like the kick on one side, the ability to be able to keep your hips even and level on the other side that's standing. So that's pretty dynamic. And then that's a slowed down version of like what you would do when you're running. So you notice there's a lot of glute med exercises in there. There is a progression that you have to go through to kind of make sure that you're actually firing it. But it's super important because really without that glute med or the ability to externally rotate your hip, you're gonna have that knock knee position. Whether you don't have it in just standing might be one thing. You might be strong enough to hold just that isometric position when you're standing, but maybe when you go through stride or you land on it or you jump on it or you go up and down stairs, then that's when your knee is gonna start wavering inward because of that lack of ability to externally rotate your hip. The other thing to this is when we train muscles, we can try to train them as much as we can, but sometimes it's the coordination itself that actually gets in our own way. So you might try some of these exercises and go, you know what, I try them, but they're just super difficult, regardless of whether I'm doing like the super easy one or the really hard one. I don't feel it in my glutes, I feel it in my quads, or I feel it on the outside of my legs. I want to say it might not be this muscle, but this one's a common one that's getting in your way.
Stand with your healthy.
So remember we talked about your hip muscles. So we talked about glute med doing this external rotation motion. So glute med does that external rotation. And if you notice this long muscle on the outside there, so that long muscle is your TFL, and then that becomes like your IT band. And most of you have probably heard at some point about having like a tight TFL or a tight IT band, and you roll it out a bunch. But you see from a coordination standpoint, when you're doing external rotation, that TFL and that IT band should relax. But oftentimes that doesn't happen for various reasons. It could be weak and then it's a little bit short, or I find that more often than not, we just spend a lot of time in flexion. So if your hip is flexed, you're going to be more biased to using that TFL because your glute med and that TFL share a common function, which is abducting the hip, which is bringing it out to the side. So if your hip is in flexion, you're going to be way more likely to use this TFL. So you might actually have an overuse of it as well because you're in a bit of hip flexion, either when you're standing or that you do a lot of sitting, and that TFL is able to get shorter and shorter over time. So one thing I like people to try is that if you're having a trouble activating your glute med when you're trying to do some of these exercises, I'd recommend actually rolling your TFL right before you try to do that glute med exercise. So really rolling, what it does is it massages the muscles. It's going to activate the Golgi tendon apparati, which dictates whether you're feeling tension in that hip. But if you put pressure on it, it actually tricks the muscle just for a little while. So the muscle itself is just going to go, oh, I feel pressure in me. And I have for about 30 seconds when you roll it. And then what it'll do is it'll actually stay a little bit quieter for the next like 60 to 90 seconds. So basically you're just tricking your muscles a little bit to try to bring in that coordination of keeping the TFL quiet where you're trying to use your glute med. So sometimes what I'll recommend to people is if you're struggling with that glute med exercise and you don't feel your glutes, I'd have you roll out your TFL first.
Lie on your side and place the foam roller underneath your affected hip. Cross your top leg over the bottom leg and use that crossover leg to help move you back and forth.
So then this guy's just rolling out his TFL. So I would suggest maybe rolling out your TFL a little bit before you try your glute meds, just to get them out of your way, because you're probably more likely to want to go and use your TFL first. So if you roll it, you turn it off a little bit, you're going to get a more likely ability to activate your glutes. Now, that's not always true for everyone. It might actually be your hip flexors that's preventing you from actually using your glute med, but I just find that that's a really common thing that gets in your way when you're trying to activate glute med, just because it's an antagonist muscle for it. And then we're going to move on to, like we were saying before, your quads and your hamstrings. So I find that you can do quad exercises, and I feel like most runners aren't going to not work their quads. You guys are probably doing lunges and squats. So I don't think necessarily we want to talk about that. We're going to talk about a lunge at the end, just about technique. But I think one thing that's always overlooked is the hamstrings.
Lie on your side.
So when it comes to your hamstrings, you'll see when we want to fire the hamstrings, the quads should turn off. Because otherwise, if the quads don't turn off when you're bending your knee and trying to kick off, then it's going to be an oppositional force. So as you're trying to push through your hamstrings to try to get that knee flexion or get that push off the ground, if your quads are still on or if they're still tight, then that's actually opposition. So you're going to get a little less push from your hamstrings because it has to fight your quads before it gives you that force that you need. So I find in most cases, people don't pay enough attention to their hamstrings. And what I'd like you to do is maybe try some of these exercises and see what the strength of your hamstrings is like compared to your quads. So this one, if you have a ball at home, you've probably seen this exercise. So it's just a bit of a hamstring curl on a ball.
Lie on your back with the ball placed underneath your heels. Lift your hips up off the floor, keeping the legs straight. Holding this position, bend your knees and roll the ball in towards you, applying constant pressure on the ball with your heels. Your hips remain level, they do not tilt. Roll the ball back out.
And then if you don't have a ball at home, what you can do is these heel slides, and you can do a varied version of these. This one is technically one of the easier ones depending on how high you bring up your hips. The only thing I'm going to point out is I find that the image and the way that they're representing this is a little bit too fast, and then I'll explain to you why you might not want to do them this fast.
Lie on your back with your knees bent and feet flat on the floor. Place a slider under each heel. Your knees and feet should be hips distance apart. Flex your feet and tighten your abdominal muscles. Tighten your buttock muscles and lift your hips from the floor. You should have a straight line from your chest to your knees. Rapidly, alternately slide your heels in towards your buttock. As one leg bends, straighten the other leg. Continue this motion, ensuring your legs remain hips distance apart and your knees point directly up to the ceiling.
So one thing about this guy and the way that he's doing it rapidly, you'll see that in the instructions, they do say you want to keep that line between your torso and your knees very straight. And he's doing it really rapidly. And that should load his hamstrings, but it's not going to load his hamstrings as much when you'll notice at a point, because he's doing them quickly. Let's see if we can get to that point. So when he gets his hips up, they are nice and straight right here. But you'll notice as he starts to do them, his hips start to drop. So I would recommend, if you are going to do this exercise, to do it actually nice and slow, and then make sure that you're not actually flexing at the hip when you get there, because then that's when he's actually losing that stability around his hips, and then the ability to actually load his hamstring is going to be a little less, because if he's flexed, he's going to be using his quads at the same time as he's using his hamstrings. So the one thing I would say is that you need to concentrate on is actually the pressure you're putting with your heels on the floor. And again, we talked about like the coordination. So if you're having trouble like doing your hamstring exercises, and these aren't the only ones that you can do, but these are the pretty easy ones that you can do at home with very little equipment. But the same thing applies to if one day we get back to the gym and that you're wanting to do like a hamstring curl on a prone hamstring curl machine. You want to avoid flexion of your hips when you're trying to activate your hamstrings. And if you're having a problem activating your hamstrings, then I would suggest
Lie on your back
rolling out your quads. So like I said, those are opposing muscle groups. So maybe your quads are a little bit too tight and that you can't actually pull through your hamstrings.
Lie on your front and place the foam roller underneath your leg. Bend the opposite leg and bring it out to the side to help you move back and forth. Roll the entire length of the thigh muscle, staying off the knee joint.
And then you can kind of like roll around a little bit on your quads too, because we'll talk about that in a second of like different ways that you can roll out your quads. So that's the hamstrings and the quad, the relationship between them. But the quads themselves are actually like a large group of muscles as well. So when it comes to your quads, we actually do have 4 of them. So then that's why they're called quads. So you have your vastus medialis and your vastus lateralis and your rectus femoris, and then your vastus intermedius. So you have 2 that kind of go in the middle. So one's a little bit deeper than the other. And then you have 2 that are on either side. So the importance to the fact that you have 4 of these quads is a little bit more related to your patella. So like when we're talking about like a patellofemoral pain or derailment, dysfunction, or OA underneath that patella, you can see that this diagram's patella is like nicely in the middle. So one thing that we think about with knees is that we have to make sure that that kneecap stays in the middle. So if we have that knock knee valgus position, what tends to happen is that the outside quad gets really tight, and then you kind of lose the ability to fire this VMO, or that it's kind of weak anyways, but this one's going to go really strong and this one's going to be a little bit weaker. So you tend to have an imbalance between these 2 quads. And what that's going to lead to at the end of the day is that this kneecap is going to start drifting outwards a little bit. And when it starts to drift outwards, it doesn't slide as well as it does. And it doesn't do that up and down motion. And then what it'll do is it'll scrape a little bit because it's not following the path that it's naturally designed to do. So what we want to do is get your VMO a little bit stronger. So you guys have probably heard about that, of doing exercises to activate it. So 2 really easy ones you can do, sitting, one is sitting in a chair, and then the other one's kind of a more of a squat motion.
Sit upright on a chair. Turn the foot of your affected leg outwards, then straighten your knee, keeping the outward rotation of the foot. Control the movement as you slowly lower the leg back down.
So that way we're going to activate your VMO. Obviously, she's doing that just with like the weight of her leg. And if
Sit upright on a chair.
you're actually having like a lot of issues with your knees, that's a good place to start. But what you might want to think about doing is adding a resistance band around your ankle, or if you have a knee extension machine, you can do the same thing with your knee extension machine. It's just that you're going to have to place your foot in that position to activate your VMO a little bit more. And then we can move on to an exercise that's a little bit more weight bearing.
Sit upright in a chair. Move yourself forwards onto the edge of the chair. Place your feet on the floor hip width apart. Squeeze a ball between your knees throughout this exercise. Lean your body forwards and stand up from the chair without using your hands. Control the movement as you slowly sit back down.
So this way you're just squeezing it and then you're getting a little bit more VMO activity. So what's really interesting about squats is that you can do squats that visually look very similar, but just the way that you change them a little bit, like squeezing your knees together or putting your weight in the front of your foot or in the back of your foot, is going to change what you're going to feel with that. So specifically around squats too, I would actually say try them out a little bit. Make sure that your knees actually stay pretty perpendicular with the ground, because if your knees are jutting forward, you're going to be more likely to use your quads and things like that. So in this case of using a VMO, that's okay, because we want to be activating your quads. But if you want to be getting a little bit more glutes involved in your squat, you might want to make sure that your knees sit back a lot more and your weight is a little bit more evenly distributed in your foot. And then when it comes to the VMO, like we were talking about before, the lateral quad and then the inside quad, and about how that tracks your kneecap. If you're having a little bit of trouble with this VMO, or you feel like it causes a little bit of pressure, if you do have a patellofemoral syndrome, you might want to actually roll out the outside of your quad. So that same roll that we were just taught before with the foam roller, just lying on your stomach and rolling it out, what you can do is you can shift your weight a little bit more on that outside quad. So that's going to release out that outside quad, taking the pressure away from that area as you try to do a VMO knee extension. So you don't have any opposition happening when you're doing either one of these exercises. And then the last thing we're going to talk about is maybe a lunge. And all this information is really true for a lunge. It's true for a squat. And I find a lot of people, because we think about squats and that how we're working them out,
Sit up.
people are really doing those like stepping lunges and trying to move forward with them. But I would suggest trying this lunge in just the stance position, a wide-legged stance position, and actually see if you have the stability to be able to get in and out of that lunge. Because if you can't do that with control, chances are when you're taking this step, you're actually just using momentum to move yourself through the lunge, and that you're not actually activating the muscles that you want.
Stand up straight and take one large step forward. Maintaining your balance, bend your knees, aiming to achieve a right angle at your hips and knees. Ensure your front knee does not drop inwards. Tighten your thigh and buttock muscles to straighten back up again. Repeat.
So you can see here that she's dropping her shoulders down in between her legs, and that she's actually making a very up and down motion with her body. What you might want to see is if you are leaning forward when you're doing those lunges. So if you're leaning forward, then you're actually not doing it with a good balance between your quads and your hamstrings and your glutes. You're probably just leaning more into your joint when you lunge the knee forward, and then you're going to use the quad that's a little bit overused even more, so you don't actually get anything of your posterior chain. Because I find that most people don't have a big issue unless they have pain in their knees of getting down. Most people can get down really low, but whether you can get down to a reasonable position and then control get back up very slowly without momentum. So you can try that at home and then see how that lunge feels. I have some question, or I have one question here in the chat, but if you guys have any questions and you want to send them in, you can go ahead and do that, and I'm going to just answer them at the end. But quickly, we're just going to go over what your homework is for this week.
Stand up straight and take.
So the Learn to Run group is going to do 8 minutes of walking and 1 minute running, and you're going to do 3 repeats in total. So it's going to be 27 minutes in total when you do this. And then you're going to want to do them 3 to 4 times a week and leave a day in between your runs. The 10-kilometer group is going to be doing a 5-kilometer steady run and 6 times 400-meter hills. So you might want to think about like your technique and your push-off when you're doing those hills. Make sure you're swinging your arms, and that you're actually going through hip extensions. That's going to be a little bit more of a increased pace for that one. And then you're going to do a 7-kilometer steady run and an 8-kilometer steady run for a total of 20 kilometers that week. And then your half marathon group, you're going to do a steady run, a 5-kilometer tempo run. I think you guys already know what that is. It's a higher pace run. So then that's why you're dropping down your distance a little bit. And then a 7-kilometer steady run. And then you're going to have a long day with an 8-kilometer steady run. Okay. So I do have one question here from Tina about Osgood-Schlatter disease. I don't know if she asked specifically, I don't know when you asked that question, if that was kind of around rolling out your quads and things like that. So basically, when it comes to Osgood-Schlatters, it usually is related to like growing. So what ends up happening is you're actually growing a little bit faster than what you have as flexibility in your quads. So then that patella tendon starts to pull at that insertion site from the bone. So yeah, loosening up your quads is a good idea. So I find that foam rolling is a good idea instead of having to bend your knee and then pull it back and trying to do that, because you might actually feel a little bit more strain on that patella tendon as you're doing that. If you're just doing the stretch. So rolling out your quads is a good idea. And also maybe just figuring out if your quads are actually really quite tight because they're being overused because the back of your legs aren't very strong. So if your hamstrings and your glutes are quite weak, if you work on those two as well as like releasing out your quads, then it'll even out the push and the pull around your knees. So that might help you with your Osgood-Schlatters. But some of that's just how fast you're growing. So if you're growing very quickly, then sometimes that's a hard thing to avoid.